We're here with Dr. Soumya in the premises of MS Swaminathan Research Foundation. She is the chairperson here at MSSRF right now. She has just recently assumed the post, and she was formerly the chief scientist of WHO through the pandemic. Hi, Dr. Soumya. Thank you so much for having us here on this sultry Chennai afternoon. How are you
Hello.
doing?
Good, good. Thank you so much for this
How has
interview.
it been for you since you've come back from Switzerland?
It's been wonderful to be back in India, and I feel like I never left at all, even though it's been 5 years I was away. And I'm very excited to take on this new role as chairperson of the MS Swaminathan Research Foundation. We're going to celebrate 35 years this year. I think we've achieved a lot, but obviously there's still so much more to do. And we work at the intersection of climate change, agriculture, health, nutrition, livelihoods. So there's a very broad area in which we can work and have an impact. So I'm very excited at this next phase of my life.
Can you tell us a little bit about what you expect your next 5 years are going to be like?
So I think I want to build on the work that's been done and the huge amounts of innovation. The foundation was set up basically to link science and society and to find solutions from existing technologies and scientific advances to make sure that it reaches the rural, poor, especially marginalized communities, to make their lives easier, to improve their livelihoods, and also to help them live better quality of life. So the motto of the foundation was pro nature, pro poor, and pro women from the very beginning. So that resonates with me as well, very well. I, of course, also look at health of individuals along with the health of the environment. And it's what everybody is talking about today. It's called One Health. It's clear that it's all interdependent, interlinked. And if we have a degraded landscape in which we live, a degraded environment, we cannot expect to be healthy. And so I think this is where we really have an opportunity to work in a way where we're managing our resources sustainably, protecting our biodiversity, at the same time not punishing people, because development is also important. And so that has to be a very unique model where we continue with development and at the same time protect our environment, whether it's a marine environment or whether it's on land. And so it's a new area, of course. For me, I have worked mainly in medical and health research for my entire career. But one thing I have learned from my own experience is that the social and economic determinants of health are probably more important than the medical support that we can give to patients. And we can treat their illness, but if they go back and they're again exposed to the same risk factors in their environment, whether it's air pollution, whether it's poor diets, poverty with all its related issues, then they're going to be sick over and over again. So this is why I would like to move upstream and look at the reasons why people get sick, and can we intervene at that area upstream, not wait for them to get sick and then diagnose and treat them, which is what a doctor would do, but really look upstream at the risk factors and work there. And I think that aligns quite well with this foundation's goals.
Right. Could you tell us a little bit about who are some of the players and stakeholders you work with as a part of MSSRF?
So our main players and stakeholders are the communities where we work. So apart from this office in Chennai, we have field sites in Kolli Hills, a tribal area of Tamil Nadu, in Wayanad, which is a tribal area in Kerala, in Koraput district of Odisha, which is also a tribal area, as well as along the coast of Tamil Nadu and Andhra Pradesh, working with fishing communities. And we have a center called the Fish for All Center in Pumpuhar near Nagapattinam. So really addressing the issues of these both rural and coastal communities, and particularly looking at impacts of climate change. So those are our main stakeholders, I would say, the community, but of course the scientific institutions in and around where we work, also globally. The government, both state government and central governments are very important. And then policymakers, the media, these are some of the other important stakeholders. And from the beginning, we've had a program here which is called the Hindu Media Resource Center. So from the beginning, there was the goal that media is important, communication is important and you need to take science to people, and that's where the media plays an important role. So we have a number of programs where we try to interact closely with the media as well.
Now, you have worked in the field of public health for a while in multiple countries. What are the differences you feel when it comes to working in public health in India versus other places, say even at WHO?
So in WHO, of course, you get a global perspective and you realize that India is probably in a much better position than many of the other low and middle income countries, because we have a very strong core of R&D, of scientific institutions, that have been built over many decades, as well as of a manufacturing base, particularly in the health space, of course, drugs, vaccines, and so on. And with COVID, that has got a further push. So I think in India, we have both the human resources and the physical infrastructure needed. Probably what needs more emphasis in India is on primary health care. And I've been impressed with countries like Thailand, but also Rwanda and Senegal, where the government has invested in primary health care very purposefully, which means, you have a limited amount of budget. You can't do everything. And so you have to make a conscious decision. Do you put it into building a big tertiary hospital, or do you put it into primary healthcare centers and sub-centers? And I think that's what Ayushman Bharat is trying to do. One arm of Ayushman Bharat is focused on building the health and wellness centers. So there's a huge opportunity now to strengthen primary healthcare. This will help in future pandemic preparedness, but it will also help us in improving the health of people and preventing them from getting sick and having to come to tertiary hospitals for dialysis or to get their heart attacks treated and so on. So again, it's about primary prevention, secondary prevention and treatment. And that's what I'm very excited about, the opportunity now. And there are lots we can learn from other countries. On the other hand, the high-income countries, we saw during the pandemic that despite the best ICUs and medical infrastructure, they had very high death rates because they hadn't paid much attention to primary health care and public health. And there were big gaps. They couldn't do contact tracing, they couldn't do public health engagement with communities. So this is where I think lessons can be learnt from our experience during the pandemic. And I feel that, we're on the right track with the Ayushman Bharat program. More attention needs to be paid to the frontline workers. They are the people who deliver care. They need to be supported, mentored, given the necessary resources and tools. I think they can do a fabulous job.
Wonderful. Now you had trained as a pediatrician. Are you still in touch with the pediatrics field? Do you contribute to it still?
So I wouldn't tomorrow want to be in a clinic treating very sick children, because I haven't done that in a while. But my interest in pediatrics, continues, because I think that I was always fascinated by the fact that I loved animals when I was growing up as a child. And I felt that children are in a similar, you have to understand from some of the signs, signals they give you as to what's going on with them. They can't articulate it. But at the same time, the first few years of life are so important, and to build the human capital of the country as well. So if we have to pay attention to the 1,000 days or the first few years of life in order to build that capital, and things like malnutrition during those early years or lack of attention to cognitive development can actually be quite damaging. So again, I think that's where my interest really is, even today, is how do we support young mothers and young children so that they get the best chance, at having a very productive life.
Right. At what point did you decide that pediatrics is what you wanted to specialize in? I read somewhere that you did consider being a veterinarian at one point.
Yes, so when I was very young, like 10, 11, 12, I wanted to be a vet, and I spent summer holidays with our family vet, learning how to give injections to dogs. And it was very fascinating. But then when I went into medical school, I very soon, I think within the second or third year of medical school, got interested in pediatrics. And somehow I was very clear that that's the specialty that I wanted to do. Again, perhaps it was because close to being a vet, or I always loved children as well. So I loved being around children. and it gives you a lot of energy, the innocence and yeah. So I think that's in my third year of medical school is probably when I decided, and then, yeah, there was no looking back. But I was also interested in research, and so along with my interest in pediatrics was how can I actually do research and not just be a clinician. And that was a tough balancing act because there were not too many institutions in India where you could do a good job at both. And so it really became at some point in my career having to choose between being a clinician and seeing a lot of patients and teaching versus being able to do high quality research. And that's so when I joined the ICMR, essentially I was partly giving up my clinical work to focus on research.
And well, now it's all public health. It's been public health for a couple of decades now.
That's right. So, from being an individual researcher who was very focused on doing clinical trials, on doing good studies and publishing them, I realized, by the time that I was in my mid 40s, that yes, you can have an impact within your academic circle. People read your papers and, you get invited to meetings and conferences. But to have an impact on the population at large, on their health, it's a public health approach that you have to take. And of course, TB was is still one of our biggest public health problems. That's what I was working on. And so I realized you need to work with policymakers, making sense of the science, translating that into policy, getting it through the political, approval process till it becomes a large program. And then it starts impacting millions of people. So I think it was a journey of discovery for me. On the one hand, understanding the partnerships with community and especially the affected communities is so important because I worked with HIV/AIDS as well, and without them you can't advance. On the other hand, the engagement with policymakers, politicians, and understanding how they see the problem and what it takes to convince them to make a policy shift. All that comes actually from experience, and so that's when I started getting more into a public health mindset.
When you work with policymakers as well as with researchers, what are some impediments or problems or even challenges that are unique to the Indian ecosystem that you don't face outside?
I don't think there are too many unique challenges. I think researchers everywhere probably face the same challenges, maybe to a lesser or greater degree. And one is funding for your work, and you're constantly looking for funding to expand your work from domestic sources, international sources. Of course, India has a lot of rules about getting funding in from international sources, so there's always many steps you have to go through, and it can take some time. So that can be quite frustrating. If you have a good idea, you can't proceed. Also in the past, I think things are changing now, but in the past, a lot of materials you needed had to be imported, particularly if you were doing lab research. And that often took months. And I noticed that in the US, for example, today you decide you want to do an experiment, you order the reagents, tomorrow morning it's on your desk. You start the experiment. And here it takes 3 months, 4 months, sometimes especially there are customs duties and things to be paid. And that can be very frustrating and you're losing time. And research is all about coming up with the right data at the right time. The other thing is, as a woman, again, it's not a unique challenge to India, I think, but everywhere you find leadership is mostly male dominated. And so as a young woman researcher, as a scientist, there's a challenge in making your voice be heard, your views be heard. Sometimes you can be ignored or just looked down upon, and it takes again a lot of confidence and some mentorship, which I had at a critical stage of my career. And my mentor was a man who actually helped me to build that confidence and continue to speak even when I felt that I was being ignored in a room full of older men. That again is slowly changing, but this is the same thing globally. So I often find myself to be one of the few senior women in a room full of men, and sometimes you're also disadvantaged if you're coming from a developing country and you're in a room full of people from mainly high-income countries. But again, that's something over my career I've learned how to negotiate those kind of discussions. So I think those are probably the other major thing I would say is, again, it's changing, is the collaborative enterprise. You look at high-income countries, particularly at the US, you'll find that they collaborate because they feel that that's the only way to move quickly ahead.
Right.
And so if you look at research, large research programs, you'll find not sometimes dozens, but even sometimes hundreds of collaborators
Yeah.
working together across disciplines.
Yeah.
That's something I think India can do much more of. We don't have enough of this type of multi-centric collaborations, particularly interdisciplinary, where you have social science, biological science, maybe computer and data scientists, working together. I think that's a very powerful model.
Yeah, I think One Health Bengaluru has just launched. They're also trying to do something
Exactly.
similar to this.
Yes, yeah.
Getting a bunch of experts on board and doing multidisciplinary.
There is recognition now that that's
Yeah,
important.
yeah. I think then we should probably move on to something that everybody's interested in hearing about, which was your stint at WHO right when the pandemic struck. How long had you been there, and what was it like when you realized that there's this new virus which seemingly is very similar to SARS? The early days in December and January, I remember people talking about how a SARS-like virus was coming from China. So what was it like in your experience at the time at WHO?
Now, it all feels like a dream when I look back. But I'd been in WHO for about exactly 2 years, and I had just become the first chief scientist of WHO in March of 2019. So literally 8 or 9 months before this happened. And so the role was new. The role of the chief scientist during an emergency or during a pandemic was not defined. And so I found myself listening in the early days of January, sitting with my emergency colleagues as they were getting data from China. And I was just sitting there and listening. And as it evolved, it became clear that this is a major, going to be a big threat to the world. And then slowly things started kicking in the sense that my colleagues in the emergency department were so, they were so busy with the response that the R&D and the science part of it automatically I took. And I had a very good working relationship with the emergency department's chief, Mike Ryan. And of course, the DG gave full support because he saw very early on that the solutions are going to come from science. And so we started convening scientists from around the world. We developed a research roadmap. We ran this big clinical trial called Solidarity. But most importantly, we played a coordinating and facilitating role, a place where global scientists could meet day and night. There were meetings going on, of course, all on Zoom, and the knowledge was coming in so quickly, and that was then moving into guidelines and into our recommendations. And so that translation was also happening, the knowledge translation. So I felt that the whole raison d'etre or reason for creating the science division was validated during the pandemic because there was such a need for someone to coordinate those efforts, work with people across WHO but also around the world, and of course then would lead to huge success in terms of vaccine development as well as in terms of the advances in understanding on viral transmission and development of diagnostics and drugs, which took a little longer than it should have, but all of this happened. As I said, WHO has a key role to play. It was undefined before the pandemic. I think it's much clearer now, and how we should build on some of the lessons that we've learned. So I personally feel very, very grateful that I had that opportunity to serve in that role and contribute in my own small way. I was just one among thousands of people working, but I think it was very critical to have that.
That's very hopeful, especially going forward in the future as well. I mean, we all expected a pandemic to come, but I suppose most experts thought that it would be an influenza pandemic as opposed to a SARS-CoV pandemic. So what are some steps that the WHO is taking right now in terms of keeping the SARS-CoV-2 virus in check? We know the virus hasn't gone away, even though a lot of people are vaccinated. So what is the WHO plan for this virus over the next few years?
So what the WHO has been saying and continues to say is, firstly, it's important to keep track of this virus because it's thrown up surprises in the past. It can throw up surprises in the future. So especially the genomic surveillance and the data sharing around that needs to continue. And we've seen over the last 8 to 12 months a decline in every country doing that genomic surveillance. But at least there should be some representative surveillance going on. And we need to expand that surveillance for other pathogens. So that is number one. Second is that every country needs to keep evaluating its situation from time to time. Because some countries are very well vaccinated, like India. There are other countries in Africa where only 25% of people are vaccinated, but okay, they've had exposure to the natural infection. So there's some natural immunity. But yet every country needs to decide at what stage do you want to bring in more of public health measures, like again advise people to wear masks. Now we're seeing, for example, other respiratory viruses, right, causing havoc in India. And the ICMR has just said it's H3N2. There's probably a bunch of other viruses, RSV. People have been indoors or people have been away from each other for 3 years, and young children haven't gone to school, they haven't been exposed. So after many years, everybody's taken masks off, people are being exposed to these viruses, and so we're getting sick. So that immunity, has been forgotten over 3 years. So I think that's why every country had a bad flu season this year, but it reminds us that the same measures, mask wearing and, the respiratory hygiene and hand hygiene helps against all respiratory viruses. And so if you're having a big outbreak of flu, you can still make that public health recommendation of wearing a mask and, the same things that we've done for SARS-CoV-2. And the other thing, of course, that we had been saying from WHO and they continue to say is we need to continue to look for better vaccine which will prevent infection. Because currently the vaccines we have are very good at preventing severe disease and death, but really not stopping the transmission of virus. And so a transmission blocking or reducing vaccine would be ideal. That's the only way you can think about eliminating something like this virus. We don't have that yet. So investment in R&D to develop more effective vaccines and to develop what's called a universal coronavirus vaccine, which will be effective against all coronaviruses. A universal flu vaccine that will be effective against that is the holy grail, because it would mean that once and for all you can vaccinate people and be confident that you're developing immunity instead of every year changing the composition of the vaccine.
In the larger scheme of things, would a universal flu or a universal coronavirus vaccine be better for someone's immunity, because we do have these 4 strains of coronaviruses that do circulate and accord us natural immunity while we're growing up. So how would that change when we have a universal coronavirus vaccine?
Yeah, that's a great question. The thing is that when we get exposed to these coronaviruses, many of them cause upper respiratory infections. The immunity we develop is not long lasting, and this is why we keep getting colds over and over again. And getting one cold today doesn't protect you from getting a cold from a slightly different coronavirus later. A universal coronavirus vaccine hopefully would target those parts of the virus that are conserved across the different variants, and that's the challenge, actually, finding that part and making a vaccine against it. But then it would reduce the frequency of colds, but also hopefully help protect against these more severe types of coronavirus, like the SARS-1 and the SARS-2 viruses. So that would be the goal. And again, as I said, there are vaccines which protect against severe disease, and there'll be vaccines hopefully protecting against infection. And the mucosal vaccines, including the one developed in India, we should really look at that very closely to see, is it better at protecting against infection? Because then it would be a huge advantage. And we had proposed in WHO maybe a combination of a injectable and a mucosal would be a best sort of combination. But it needs to be studied. We don't know whether these mucosal vaccines are going to be better. Theoretically, it should be possible. But again, we need the data. So India has a lot of opportunity now to collect data, because we have so many vaccinated people with many different vaccines. So we can study the duration of immunity by age, by gender, and by vaccine type, and then that'll help us make policies for the future. Because as one of the questions is, are we going to need an annual booster for SARS-CoV-2? We don't know the answer to that.
Right. And we would also need to learn a lot about long COVID to be able to
Exactly.
come to these answers as well.
Because again, there's a lot of concern that even beyond 1 month of COVID, you have effects on your heart, on your vascular system that can brain and even diabetes risk goes up. So we need to understand the pathophysiology behind that.
Yeah. But you are feeling hopeful about the development of mucosal vaccines. Do you think we'll be seeing those soon?
Yeah, there are several. I think one has been launched in India, the Bharat Biotech one, but there are several more in development using different platforms. So again, I think we need to look carefully at what each of them is doing and study them scientifically. Ultimately, it's the data that's going to inform us.
Yeah.
And so it's really important as these are developed and rolled out that there's a plan to actually collect that data.
Yeah. Okay. Since we're talking about the SARS-CoV-2 virus, I have to ask you, we keep hearing about these reports regarding the origin of the virus. Now, from what I understand, it seems evident that this is natural. This is not created by humans. And we still have these, just a few days ago, we had yet another report that talked about how the Department of Energy suspects that it could have leaked from a lab with, I guess, low confidence in their data. So what are your thoughts, and why do you think this narrative keeps coming up again and again about where the virus originated?
Well, the narrative keeps coming up and the debate goes on because we don't have the answer yet. And so it's very natural that people still want to know. It's such an important question. And WHO has said from the beginning that we need to know and everybody needs to cooperate. All countries should work together. But because we didn't have the full cooperation from the Chinese government to collect all of the different pieces of data that would have helped to build up the story, we don't know, for example, which animals were involved. If it was a natural infection jumping, say from a bat through some intermediate animal to human, and let's say it happened in that market, the Wuhan live, food market, what was the intermediate pathway? That needed good, strong research. And as time goes by, it's more and more difficult to go back 3 years and collect that data. The second hypothesis is a lab accident or a leak, not a man-made thing done on purpose, but a lab accident, which is still on the table. It has not been ruled out because there hasn't been enough evidence to rule it in or rule it out. So I think the WHO still says that this is an open question, that we need the data, we need the research, we need everyone to cooperate. And yes, this US report did suggest, it could be, yes, from the beginning we've said it could be a lab leak, but it could also be a natural infection. And they haven't provided any data to support either of these two hypotheses. So again, it's low confidence in the report, but it again highlights that for future prevention of pandemics, it's really important to understand how these things happen. We know it's close contact between humans and animals, but if you really want to prevent it for the future, then understanding these pathways, is very important.
Right. And while during this pandemic, for example, what was completely unexpected was, I believe there was a survey just before the pandemic about which countries are well prepared to deal with the pandemic, and US and UK came out at the top. What was very surprising to me, at least, was the extent to which conspiracy theories can affect public health. How has your experience been there, and what can we do to combat and increase awareness about legitimate public health ideas versus conspiracies?
Yeah, that's really important, because one of the things that we had to deal with in WHO, but many countries had to deal with, was this whole thing of misinformation, disinformation, what we call the infodemic.
Yeah.
And particularly using social media, some groups, anti-vaccine groups, started this propaganda even before vaccines were developed for SARS-CoV-2, and they've done a lot of damage in many countries where people became very scared of taking the vaccine because they had heard such terrible stories about these vaccines. It's a real pity because in many countries which had enough vaccine, they had no shortage. Still, you had lots of people refusing to take it and therefore dying of the infection. So I think for the future, for public health in general, it's going to be very important to pay attention to the sources of information that people have. And I think it's a whole area of study. It's a science by itself. And we've neglected that. And we now realize that you need social and behavioral science to have an effective public health response, because you need to understand what people are thinking, what are they talking, why, where are they getting the information from, who are they listening to, who are the influencers, and then the public health agencies need to target their communications in a way that you're actually addressing the questions that people have.
Right.
And very often we give information thinking, okay, we know it all, we're telling you this is what you should do. People have a different understanding, they have different questions, and we're not even addressing those. So I think it's a very important lesson for public health agencies and ministries of health around the world for future. Take non-communicable diseases, not just pandemics. Let's take the huge problem we have today of obesity and diabetes. This needs a lot of behavior change. And we are heading in a direction which is quite dangerous, because we're going to be overwhelmed. Our hospitals are going to be overwhelmed with people who come with complications. So we need to really start working at what are the drivers, what are the risk factors, why are people eating in a particular way, why they're not able to exercise, why they don't, tobacco consumption not going down, etc., and really start addressing those so they can live healthier lives. And that needs a very different approach than a biomedical approach of, okay, you've got diabetes, these are the drugs, please take them. And it's much more complex to address that. So this is where we need, I think, medical doctors and epidemiologists sitting down with the social scientists and working out and doing those kind of research studies.
We know that countries like China, for instance, learned immediately from their SARS epidemic, even Hong Kong, and they're very diligent about masking. So what are some things that, as someone who is an authority figure, what are some things that you think that authorities have learned about how the public responds to pandemic in today's times? And what are some things that probably you think the WHO might do different should another pandemic come tomorrow?
So at the WHO level, as you know, there's this whole discussion going on around the pandemic accord or treaty. And that was because countries did not work together in a united way, and there was a lot of inequity in access to vaccines. So the pandemic treaty is trying to address some of those issues as to, in a global emergency, what are the rules by which all countries need to play. So we need that at the global level, inter-country collaboration. At the national level, I think, again, many lessons learned, including the need to strengthen our public health systems, to have the kind of people at the sub-district level. Because, everything starts in a community. A new virus can come up anywhere, at any time. So you need the local doctors and nurses and people to be aware that if you start seeing something unusual, what do you do? Whom do you report it to? You need a district epidemiologist who's trained to do this. You need data systems, which again India is trying to work on this One Health approach, where you have monitoring of animals and animal viruses in addition to humans, and the two are talking to each other. So you have to keep an eye on what's changing in the animal viruses, how is influenza or other viruses mutating, and the environment where these things happen. So again, you need interdisciplinary research, and you need data systems, you need surveillance, and most of all, you need a mechanism for normally siloed groups to work together. So at the time of the pandemic, right, it became an all-of-government response. It wasn't just the Ministry of Health. You needed actions across. So I think in a crisis, now we've learned, how do you activate a mechanism like that? Who all should be part of that? And again, I think one element that was left out was civil society. Civil society needs to be part of this, and that's where the community engagement actually comes from. And we saw cities and states that did better than others in community engagement. They were more successful. So lots of lessons learned, and I hope that those are all captured and taken forward and not forgotten. You mentioned SARS-1,
Yeah.
and it was true that those countries which had SARS-1, they immediately changed their behavior, right?
Yeah.
People put masks on. They didn't
Yeah.
even have to be told.
Yeah.
But for the rest of the world, it was like masks, you know, and there was so much
Violation of
controversy
personal
and
freedom,
exactly, and all of that, and no, we need the evidence. But countries which had experienced it and knew this is one thing simple you could do, and you could, and India was one of the early ones actually to bring in a mask.
Yeah.
We didn't do some of the other things, like we still allowed big crowds and things, but we did bring in mask mandates quite early on. So we've also learned that the damage that can happen, say, by closing educational institutions for so long was unnecessary, because in many countries they managed the pandemic without closing schools for more than a few weeks, whereas most low and middle income countries kept schools closed for 2 years. And that damage that has happened to that whole generation of children is going to take some time to recover from it. So I think again a lesson is which are the things that we should prioritize and keep going even as we are facing the threat.
Yeah. I suppose my follow-up question to that is, what do you think are the consequences of the pandemic, the first 3 years of the pandemic, that you think we will experience over the next 5 years or so? Like you said, schools shutting.
Yeah, so I think the educational losses will be one. You mentioned long COVID. We still don't understand it. And so we need to really anticipate maybe a higher incidence of some of these cardiovascular and neurological diseases. Maybe we need to be prepared. And I think the economic impact of COVID on many, many families, particularly the poor, will also be felt. We could see, increasing undernutrition and consequently other diseases. So even though all governments tried to support as much as possible with social support, still the poorest and the most vulnerable did suffer in all countries. And so I think we're going to see that. And of course now the war in Ukraine has made things a lot worse in terms of food supply and in terms of the global economic environment. Instead of investing in health, we're investing in the war. I mean, many countries are throwing billions of dollars into the war. It's really unfortunate, because that could have gone to health, it could have gone to nutrition, it could have gone to education. But unfortunately, it's all going into a very destructive thing. So I think we'll face a few tough years ahead, but we need to build that resilience and set our priorities.
Yeah, and hopefully implement the lessons that we've learned
Correct.
from the pandemic as well.
Yeah.
Yeah. Thank you so much, Dr. Soumya. This was a very insightful discussion. Is there something that you would like to tell our viewers?
Well, just that I think, I hope everybody's belief in science has gone up during the pandemic, and the fact that it's important to invest in science, invest in R&D pays off in the long run. And so we need more young people going into science. And also I think I've learned the power of collective action is very strong. When communities come together, when civil society comes together and raises their voice about certain things, like they did about vaccine inequity, you can change things in the world. So I believe that there are lots of positive takeaways from the pandemic, and I hope that we can build on them.
Right. I hope so too. Thank you so much. This was a lovely discussion, very insightful, and I hope our viewers also learned as much as I did. Thank you for sharing your experiences and for having us here.